Hi, this is Irina Kay, and this is my channel, Astro Babushka. I am a Vedic astrologer, and I apply ancient knowledge that is more than 3 years old to modern times. Today, I want to talk about something very ambitious, how astrology could be used in the field of mental health, crime prevention, and even government policy. Now, before I begin, let me make something very clear. Astrology is not a replacement for psychology, for psychiatry, or medicine, but it can serve as a complementary timing and risk assessment tool. And if taken seriously, it could become one more way to save lives, reduce crime, and help people who are struggling. So let's start with the most practical question. How could astrology actually be used in mental health? First, crisis forecasting. Astrology allows us to flag periods of high instability. For example, when Saturn and Mars transit over a person's moon, for individuals already diagnosed or with a criminal history, these windows are like red flags. They could alert doctors, caseworkers, and families to increase therapy sessions or medication checks during this time. Second, early intervention programs. In mental hospitals, astrology could be used alongside psychiatric charts to schedule treatments, to predict relapses, or to monitor patients during eclipses, retrogrades, and other high-risk alignments. Third, rehabilitation tracking. We know that not every day is equal for therapy. Some periods make patients more receptive, others create resistance. Astrology can help find a time when therapy is most effective, avoiding setbacks. Fourth, community safety. Governments already track high-risk offenders. Astrology could add another layer of prediction, pointing to when a person might spiral or relapse. And fifth, research data. If hospitals collected anonymized birth data with consent and compared it with records of admissions, violent incidents, or psychotic breaks, we could build a statistical foundation that proves or disproves astrological timing. This would give solid evidence, not just theory. Now let's talk about the harder part. How do we move this idea into official structures like hospitals and governments? Step one is research. Publish case studies. Show small-scale statistical reports where planetary transits line up with psychiatric crisis. That will create legitimacy. Step two is pilot programs. Approach universities or research hospitals that already have integrative medicine departments. Suggest a trial where astrology is combined with psychiatric monitoring. Step three is language. We must never frame astrology here as a fortune telling. Instead, we can use words like chronopsychology or cyclic risk timing or cosmic chronobiology. In other words, present astrology as a pattern-based timing method that supplements existing models. Step four is allies. Governments will not listen to astrologers alone. We need sympathetic psychologists, psychiatrists, or criminologists to co-author papers. When experts stand together, doors open. And step five is policy. Governments spend billions on crime prevention and mental health. If astrology can show that it reduces relapse rates or predicts outbreaks of violence, it becomes a preventive public health tool. And prevention means saving both lives and money. So what can someone like me or you do personally to move this forward? First, build a research corpus. Collect 50 to 100 case studies of violent crimes and mental health relapses, with the notion to the astrological patterns. As of right now, I published 5 case studies on my YouTube channel and plan to continue. For astrologer, it is detrimental to know exact birth time. So if you are someone who has knowledge of a serial killer or maniac birth data, that would really be helpful for me if you share. Second, I intend to write a white paper, keep it short, structured, professional, with the data and charts, something that I can hand to psychologist or policymaker. Number 3, I need to find academic allies. There are progressive psychologists and criminologists out there who are already interested in timing models and behavioral cycles, so I will look into there. Number 4, I should start small with mental hospitals. Maybe some psychiatric institutions allow experimental programs if they are framed as research, not as policy change. Number 5, maybe lobby through think tanks instead of aiming directly at government, present at conferences or policy forums where new ideas are incubated. And 6th, I should connect with NGOs, organizations working on crime prevention, prison reform, or mental health advocacy. May be much more open to this than official government structures at first. And now, let's dream a little bigger. Imagine if this work gains traction, we could have astropsychological risk calendars in hospitals and prisons. We could create training modules for psychologists and therapists. We could deliver government reports showing measurable cost savings in crime prevention. And eventually, astrology could be legally accepted as a complementary assessment tool, just like psychological profiling or even polygraph tests once were. So here's my suggestion. Position astrology research not as belief, but as a predictive model of human cycles. Governments are slow to adapt, but they respond to data, risk reduction, and cost savings. And to Ted Bundy's challenge, you can't identify them. I say maybe you can, maybe I can, maybe with astrology, psychology, and science working together, one day we will be able to. Thank you for listening. If this vision resonates with you, subscribe, share this video, and let's continue to bring ancient knowledge into modern systems where it can truly make a difference.